My name is Joe Peroni, and this is the Rise Above Project. So the first question of the day, what is the largest organ in the human body? Now, most people think it's the skin, but that's not true. The muscles are the biggest organ of the human body. As a matter of fact, it's also considered to be an endocrine organ. So muscles are extremely important. They're not just for vanity. However, vanity is a good place to start as we look at its importance. So number one, women do prefer men with muscles. Gay men are actually even more attracted to muscular men than women are. And men do prefer women who are in shape. Now, the degree of muscularity we can have a debate about, but there is no debating that most men do prefer a woman who is in shape. So let's backtrack a little bit. Let's talk about some of these women who, in these surveys, some of them do say that they prefer a guy with a quote unquote a dad bod. But is that true, really? Because if we look at that with a little bit more depth, what we find is that it's more of a self-esteem problem in the women. In other words, they don't want to be around a guy who gets a lot of attention, possibly more attention than they do. They don't want a guy who's attractive to a lot of women, and therefore, as they're trying to figure out if it's worth dating or having a relationship with a guy who's in shape, they want to know that he doesn't have a lot of options to cheat. So sometimes it really comes down to a woman who has low self-esteem will choose a guy that's not very attractive. But in the end, you can see these women alone sometimes at night when their husband or their partner's not there. And they're going to be going over some of the old movies that The Rock is in. They'll be watching The Witcher or Superman and things like this. Because women actually are much more attracted to guys who have muscle. And the ones who say that they're not, well, the problem is that they're actually trying to prioritize different things. Now, what else are muscles important for? Well, of course, body movement, we know that. It's important for posture, it's important for joint stability, important for heat production, or we could say it improves your metabolism. Obviously, it's important for strength. But let's talk about the most important things that muscles are important for. And in order to answer that question, let's get to this question. What happens during exercise? Well, the easy answer is that muscles contract. So the next question, what happens when muscles contract? What happens is that myokines are released from the muscles, meaning that muscles are not just responsible for movement. Muscles are an organ that secretes messengers to other organs. Muscles, when they're contracted, release myokines, and then they have the ability to crosstalk with other major organs of the body. So let's get into a little bit more detail of what this means. Because what we're really talking about here is intracellular signaling. That's what the muscles do. Now, there's three types. We can talk about autocrine, paracrine, and endocrine signaling. So the first one, autocrine, it means that the signaling acts on the muscle itself. Here's an example. Let's say you're weight training and you're doing it at a sufficient level to where it creates muscle breakdown. What's going to happen here is that the muscle itself is going to be able to tell itself to grow. We call that hypertrophy. So it's signaling and it acts on the muscle itself. The second one I talked about was paracrine. This is where when signaling, it actually puts the action on the cells in its immediate environment. An example of this would be if you cut your finger, then the blood in that area will clot. Now, obviously you don't want the blood to clot in all areas of the body, right? You just want it to clot in the area that it needs to. So with paracrine signaling, it only acts on the immediate area or the immediate environment. Now, when we're talking about endocrine signaling, it acts on distant cells of the body. An example of this is that it would increase insulin sensitivity. Now, so in this way, exercise stimulates muscle contractions. And what that does, it releases myokines. The myokines help to increase the potential of every other organ in the body to do its job. And in this way, it improves cognition, memory, and it fights dementia. So therefore, when you exercise, you'll be able to increase your brain power. And this is another reason why, with study after study, when you have exercise put up against antidepressants or anti-anxiety medication, training or exercise or working out always will beat medication or prescribed medications in combating anxiety and depression. This makes sense. And on top of that, obviously working out increases self-esteem, but that's a whole nother story. So yes, working out and contracting muscles will increase your brain power, and it increases your mental health. Now, it also decreases cardiovascular disease, your chances of getting cancer, your chances of getting diabetes, and neurodegenerative diseases. Obviously, it increases energy and decreases inflammation throughout the body. So there's absolutely no reason why somebody would or should choose not to work out. So let's look at it like this. Inside all the muscles of the body it's kind of like having a bunch of unemployed taxi drivers, Uber drivers, and Lyft drivers, just sitting there waiting to take messages all the way throughout the body to help every other organ in the body do its job a little bit better. And they're all unemployed. And why are they unemployed? They're unemployed when you're sitting on the couch doing nothing. Now, in order to engage all of these unemployed drivers to send the messages, all it takes is one simple act, is getting off the couch and working out. Some type of exercise that contracts the muscles, that will release all of these Uber drivers, taxi drivers, and Lyft drivers to go around the body and do its job in helping every single major organ of the body. So really all this takes is the one thought process to say, I am going to work out today. So is that your decision to do today? Are you going to work out today? Hopefully this has been beneficial to you in some way. My name is Joe Peroni, and this is the Rise Above Project. Thank you.